Hello, everybody. Today's topic is Rituximab, and these are my disclosures. There are no relevant financial disclosures. I'm an associate professor in hematology and medical oncology, treating adult patients, and the information I am providing today is mostly available from the U.S. Food and Drug Administration labeled package insert and from already existing published data. And additional information could evolve after the date of this presentation, and risk of adverse events could vary based on the indication of the use of a specific drug. And please talk to your pharmacist or your doctor for specific questions or concerns about any specific drug. These are the objectives about this particular drug presentation. This is to improve the understanding about rituximab and educate about specific clinical uses of rituximab. And the goal of all my presentations are going to be patient-centered and to improve their understanding in simple language and to provide them useful information when they're choosing this particular drug. And to also give some basic information about clinical outcomes data and to know what to expect from a particular drug. So what is rituximab? Rituximab is a chimeric monoclonal antibody directed against CD20 antigen on the cell surface of a B lymphocyte, as you can see in this diagram here. And binding of the antibody to the CD20 antigen on the B cells leads to killing of the B lymphocyte via antibody-dependent or complement-dependent mechanisms, ultimately leading to the B cell cytotoxic effect. So these are the labeled indications for rituximab, including non-Hodgkin's lymphoma, like low-grade B-cell non-Hodgkin's lymphoma, like follicular lymphoma, either relapsed or refractory or completely untreated patients, and untreated diffuse large B-cell lymphoma in combination with CHOP chemotherapy, and chronic lymphocytic leukemia in combination with FC chemotherapy, which means fludarabine and cyclophosphamide. And it is also used in many autoimmune conditions, including rheumatoid arthritis in combination with methotrexate, or granulomatosis with polyangiitis, also previously called as Wegener's granulomatosis, and microscopic polyangiitis in combination with glucocorticoids. It is also approved for moderate to severe pemphigus vulgaris in adult patients. These are some of the clinical trial data to know about this drug and what to expect in patients with relapsed or refractory low-grade B-cell lymphoma. As a single agent, the complete response rates are around 6 to 14%, with an overall response rates around 50 to 57%. And patients who do respond, their median duration of response is anywhere from 7 to 15 months. And I have a separate lecture about how to better understand the terminology of these specific terms like progression-free survival, overall survival, etc. So in previously untreated non-Hodgkin's lymphoma, the progression-free survival is around 2.4 years versus 1.4 years in patients who did not receive rituximab. In diffuse large B-cell lymphoma, the progression-free survival is significantly prolonged to up to 3.1 years, with a significant improvement in overall survival to 74% when used in combination with CHOP chemotherapy at a longer term follow-up. And in CLL, there's a 86% overall response rate, and in rheumatoid arthritis, there's a 51% response rate, and in vasculitis around 64%, and in pemphigus vulgaris it is close to 100% response rates. So this is a drug which is given as a slow intravenous infusion, and it should not be infused as an intravenous bolus or push. And the dose for a non-Hodgkin's lymphoma is around 375 milligram per meter square. And for CLL, it is the same with the first cycle, followed by 500 milligram per meter square from the second cycle onwards, up to a total of 6 cycles when used in combination with fludarabine and cyclophosphamide. In rheumatoid arthritis, which is one of the common indications used by our rheumatology colleagues, a flat dose of 1000 milligrams given every 2 weeks as one course, given every 24 weeks, which is roughly around every 6 months. And usually methylprednisolone, also called as solumedrol, is used as pre-medication before the drug is infused to avoid any infusion reactions. And in patients with vasculitis, the same dose like a non-Hodgkin's lymphoma of 375 milligram per meter square once a week for 4 weekly doses is commonly used. There are no listed major contraindications in the US label, but based on our other available data, people who have severe anaphylaxis to murine proteins, in other words, to mouse proteins, as it is a chimeric monoclonal antibody, meaning the antibody has a protein part which mimics a mouse a sequence, and as this is a recombinant protein made in Chinese hamster ovary cells, anybody with a reaction to such proteins also is listed in contraindications in some literature. And patients with history of progressive multifocal leukoencephalopathy, it is recommended to avoid it in such patients. Boxed warnings are made by FDA to highlight some of the very important side effects of any particular drug, and these are some things which patients ought to know before they receive any specific drug. So for rituximab, the boxed warnings include fatal infusion-related reactions within the first 24 hours, and most importantly, majority of them occur within the first 24 hours. 80% of them, but nevertheless, rarely they can happen with subsequent infusions, though it may not happen with the first infusion. And severe mucocutaneous reactions like pemphigus, like Stevens-Johnson syndrome can also occur with rituximab, and other practically important point, including hepatitis B reactivation leading to fulminant hepatitis, is a very important thing to know, and this is the reason why we make sure that we rule out any active chronic hepatitis B or natural infection to hepatitis B in the past, as such patients should be properly treated before using a drug like rituximab. And rarely, a rare fatal neurological complication called as progressive multifocal leukoencephalopathy can occur in patients who receive rituximab. Some of the warnings and precautions using this drug include tumor lysis syndrome. What it means is if the B lymphocytes are massively destroyed, release of certain chemicals like uric acid or change in electrolytes in a short period of time can lead to some of these side effects, like cardiac adverse events or renal adverse events. And certainly rituximab is not used in a patient with active infection unless the infection is properly treated, and cardiac adverse events can sometimes be life-threatening, like arrhythmias of the heart, where patients can develop significant arrhythmias like ventricular fibrillation or atrial fibrillation. And renal toxicity can happen from tumor lysis syndrome, Also, bowel obstruction or perforation reported with use of rituximab. So, paying attention to such signs and symptoms is important. And use of live virus vaccinations is not recommended when patients are receiving rituximab or are about to receive rituximab. These are the most common adverse events listed with use of rituximab. As you can see, the frequency varies with the indication, but in non-Hodgkin's lymphoma and CLL, the most common reactions are infusion related, including urticaria, which is skin rash, or drop in blood pressure, or drop in oxygen levels in the lung because of bronchospasm, which is constriction of the small airways, or sometimes other significant cardiac side effects like myocardial infarction or ventricular fibrillation are reported. Fever and chills are very commonly reported with rituximab, and as it is a B lymphocyte killer, it can certainly lead to low number of lymphocyte count in the blood after receiving this drug. Sometimes drug related drop in neutrophil count, which is a different type of white blood cell, is also reported with rituximab. In other indications, which are mostly autoimmune, the other common problems listed are infections, as you can see, like urinary tract or upper respiratory tract infections, in addition to the infusion reactions like listed above. There are no major drug interactions, but renal toxicity was reported with the use along with cisplatin. This is to warn about patients in specific situations like pregnant women or women who have a potential to become pregnant. Use of appropriate contraception is necessary, and use during pregnancy is not recommended either due to potential risk for fetal harm, though the literature is not completely clear about its harm when used in pregnant women. And in CLL patients older than 70 years of age, in an exploratory analysis, there was no benefit in addition of Rituxan to FC or fludarabine cytoxan. So these are the listed important counseling points when we talk to patients about rituximab. Most importantly, to highlight and to recap, using rituximab can be associated with infusion-related reactions like what we talked, and severe mucocutaneous reactions like Stevens-Johnson syndrome, reactivation of hepatitis B virus if they are not appropriately screened, and very rarely neurological infections leading to progressive multifocal leukoencephalopathy is rarely reported. Therefore, patients presenting with vague neurological symptoms like confusion or change in mental status should be addressed when they receive rituximab. And tumor lysis syndrome should be watched for based on frequent blood tests and making sure that their renal functions are not affected, and in appropriate patients watching for cardiovascular adverse reactions during or immediately following rituximab infusions should be watched for. And as we talked about, the bowel obstruction or perforation should be watched for, particularly signs and symptoms like abdominal pain, and embryonal and fetal toxicity should be addressed in women in the right age group, and then women who are lactating, its use should be avoided and warned about. These are some of the additional resources I have listed for voluntary reporting of adverse reactions, and have listed some of the numbers here and websites where you can always feel free to report any additional adverse events if you may have experienced while receiving this drug. Rituximab and hyaluronidase is also called as Rituxan Hycela, is a subcutaneous formulation of Rituxan, meaning it is given under the skin and not into the IV, which is FDA approved for the treatment of follicular lymphoma, which is a low-grade B-cell non-Hodgkin's lymphoma, and also diffuse large B-cell lymphoma and chronic lymphocytic leukemia, like what we have described. And there are two biosimilars which FDA had approved, as I have listed here, with very similar indications like Rituximab. Thank you very much for watching this video, and with that I will conclude this presentation, and feel free to leave any comments below if you have any, and thank you for watching.